Hello, on behalf of the Spina Bifida Association staff, welcome to the SBA's Community Information Session, Navigating Independently with Spina Bifida. My name is Judy Thibodeau, a member of SBA staff, and I and my colleague, Juanita Panliner, will be with you for tonight's presentation. Before we begin, a few housekeeping notes. If you have a question or comment, please feel free to use the Q&A feature at any time, and we will try to get to as many questions as possible. However, there will be an Ask the Expert webinar on April the 9th, during which questions not answered tonight and others submitted when registering will be answered. You may also use the chat function to communicate, which we will not be monitoring as closely. You will receive the recording of this presentation and an evaluation survey. Please take a minute to complete the survey so that we will learn what topics are important to you for sessions like this in the future. Lastly, tonight's event is being recorded and we will post the video to our website soon. We are pleased to have Shannon Bevans as our presenter tonight. Shannon is the Adult Transition Coordinator at the Spina Bifida Clinic at Orlando Health, Arnold Palmer Hospital for Children. Thank you, Shannon, and welcome.
Well, hello. Thank you so much for having me. I'm really excited to be with all of you tonight to speak with you about a topic that I'm really passionate about. Not only I do this in my professional life, but I have a lot of personal experience with this. And hopefully at the end of this, you will gain some tips and tricks on how to navigate independence as an adult with spina bifida. Professionally, I am a social worker and I'm the Adult Transition Care Coordinator at the Spina Bifida Clinic at Orlando Health. And so literally my job is to help youth and young adults transition to adulthood. That's adult-centered care, that's independent living, that's supported decision-making, the whole nine. So I really am in a very fortunate, I really love my job. It's a really fortunate, it's a really unique role. And personally, I have a lot of personal experience with this. I'm an adult living with spina bifida. I'm 35 years old. And for all intents and purposes, I guess you could consider me independent. I have lived independently on my own since I was 17 years old. I have a bachelor's and a master's degree in social work that I put myself through college, working a part-time job before the age of 25. I've lived on my own since I was 17. I work, I pay bills, I pay taxes, I drive, I do all of the quote unquote normal things that a person would do. But that has certainly not been without its bumps. And I have, like a lot of adults with spina bifida, I aged out of a pediatric clinic at 18, and I was kind of just dropped into the abyss of nothingness of the adult world, and I had to learn how to navigate it on my own. So hopefully, what I'm going to share with you this evening will be some help to you, both from a personal and a professional standpoint. So really quickly, before we talk about independence, I want to make sure that we understand that independence is very subjective. Independence is not, there's not one way to define independence, but there are two key things to think about independence, and that's self-determination and autonomy. And self-determination is essentially the desire or the ability and practice of directing your own life. And it's often referred to as the big picture because it has so much to do with who you want to be and the person you want to come and where you want to go. And similarly to that, autonomy is important because it allows a person to manage their own, to kind of manage on their own and to balance everyday tasks and become more independent. And it's really to help you make your own decisions. So independence is like I said, what independence is not. Independence is not, I can do everything myself and I don't need any help and I completely got this on my own. That's not independence. Independence is the ability to make your own decisions and to advocate for yourself. And I also want to put a note in here that independence can be very subjective, but it can also be very cultural. And by that, I mean, you know, in some cultures, moving out on your own and living by yourself is not necessarily considered to be independent. It might be that you achieve certain cultural norms within your family. So again, independence is just very subjective, and it's there are lots of different definitions. So when we think of independence, this is by no means a comprehensive list, but some of the ways that we think of independence are living on your own, managing your own finances, driving or taking public transportation, managing caregivers, or as I had said previously, taking an active role in the family or achieving cultural norms related to self-management. So that might be something like a bar or bat mitzvah, for example. That can be considered a you know, an achieving of independence, if you will. But these are just some of the topics that I focus a lot on in our clinic, but it's by no means a comprehensive list. And I'm sure that many of us could think of lots of different ways that we define independence. And it's important to know yourself. So how do you define independence? And when I work with patients, I tell patients, so how do you want to define independence? But you have to understand your strengths and your weaknesses, both in social and academic areas. And in our clinic, I start that process in middle school. I personally believe that it's never too early to start this process, but I officially started in middle school. And I always tell patients when they come into our clinic, I say, give me 3 things right on the spot that you're good at, and tell me 2 things that you might struggle with. And they could be anything. But it is so crucial that you understand what you're good at and what you might need to focus more on, so that that can help you kind of understand and decide what is the most achievable way towards independence for you. As I said, we identify this in middle and high school. A good way to do this, I tell with my youth that I work with, is to utilize volunteer work as a means of learning your strengths and your weaknesses. Volunteer work is a really great way to not only understand what you're good at or what you might struggle with, but it's also a really great way for you to understand what you like and what you don't like. So I usually try to encourage some type of volunteer activity when they're of age. So that's usually like age 15 or 16. And then to just focus on your interests and build on your strengths. And this was actually touched on a little bit in the previous lecture, but I think it's important to note the levels of support as youth age. So Dr. Zabel, I love how he always notes that people with spina bifida, we just have a lot more to self-manage. We just have a lot that we have to deal with that a person without spina bifida doesn't necessarily have to manage. Things like cathing, bowel and bladder programs, skin checks, med management, stuff like that. So there's just an additional layer. There's a lot more stuff that we have to manage. And when you have executive functioning problems, and I say that as a person who has problems with executive functioning, severe problems with executive functioning, it is so hard to you know, have all of these additional things that you have to manage. But then on top of that, now you're asking us to figure out, okay, well, how do we prioritize that and how do we organize it? So it can be kind of a perfect storm for somebody with spina bifida who's trying to learn how to become independent with those kind of 2 key factors. And the other thing that's added to this is that it doesn't matter if you have spina bifida or not. As part of adulting, you increase responsibility and decrease supports. That's part of that's part of becoming an adult, is As you get older, your responsibilities are expected to increase, and then the supports on that are expected to decrease. So all of that on top of having a lot to manage and then possibly executive functioning problems, it can be challenging, not impossible, but it can be challenging. So all of this to say, aside from that, you are still legally responsible for yourself at age 18, regardless of whether or not you are ready. I will say that again. You are still legally responsible for managing yourself at age 18, regardless of whether or not you are ready. And we will get to making supported decision-making here in a little bit, but it's important to know that regardless of whether or not you know it, legally, there will come a point where you are expected to know these things. And that's what we want to focus on, is being ready for those things. And if you struggle with those things, then we have to designate a person or people who can help you make those decisions. So I just want to share a little bit of my work with our patients and our families as it relates to independence. And I say transition or independence or becoming an adult is a two-way street, and to do what you can. And what I mean by this is that we can build all of the support systems in the world for you. We can build all of the adult care in the world for you. We can provide all of the supports that you need. But at the end of the day, there is going to be a piece that is on the person, and it is a part of personal responsibility. It's not to say that you have to be perfect. It's not to say that you have to know everything. You just do what you can. But to understand that transition is a two-way street. It's not just building the support systems. There's got to be a little piece of self-responsibility to that as well. I talk a lot with our kiddos, with our youth, about learning how to ask for help and effectively communicate your needs. And I tell people, we can't help you if we don't know what you need. I mean, we can, we have ideas, but specifically, especially in the adult world, we don't always know what you need unless you're able to communicate it. I remember very vividly one time when I was a child, I had bilateral surgery. I had surgery and I had bilateral casts on, and I was sitting on the floor and I needed a cup of juice, or it was some kind of juice drink that I was looking towards on a counter. And I couldn't get it. I just kept looking at it, and I kept looking at my mother. And so my mother, she crouched down and she got to my level and she said, "What do you need? And how do you ask for it respectfully?" And I never forgot that, because at that moment, she was trying to teach me I needed to ask for help. I needed to ask for help, but how did I do that? How was I going to deliver that message? So that's what I tell the kids, the youth that I work with, is that what do you need? How can we deliver that message? How can we help you communicate your needs? Allowing youth to perform self-management tasks and then not be successful with them. Sometimes they will fail at them. So examples might be things like learning how to make your own doctor's appointment. I have a thing with the kids I work with, that after you age out of the clinic, I don't make your doctor's appointments. I don't do it for you. I help you and I will teach you. I will 150% be in your corner to teach you how to do it, but I will not do it for you. And sometimes that means that you're not going to be successful the first time. That's part of learning, and that's why we practice. So it's okay. It's okay to fail the first however many times, as long as you just practice it. Goal setting. Goal setting is so important. And that's maybe the social work heart in me saying this, but goals are just so important, because then you know where you're at. And it's a good way to track. It's a good way for you as the person to know where you're at, and it's good for the person helping you to know where you're at. So tracking and goal setting is really, really important if you can do it. And as I said, after aging out of our pediatric clinic, care coordination kind of becomes a little bit more hands-off, and that's just the adult world. That's just the adult world. It just becomes more hands-off. Do I think that maybe we could provide more support? Absolutely. Absolutely. But the fact of the matter is that it's not nearly as hand-holding as in the pediatric world. So some of the questions I noticed, and the questions I get also with the kids I work with, are related to post-secondary education and employment as it relates to independence. And it's important that we talk about it because there are ways to utilize it, but you have to kind of know what you're doing. So I tell people, you really need to understand what a reasonable accommodation is. And we'll get into that in a minute about kind of what it means, but both in an employment setting and a college setting or post-secondary setting, you should know what a reasonable accommodation is. Also, utilizing disability resource offices on campus. And you don't have to be an expert in disability policy, but it's a good idea for you to understand rights and responsibilities of the individual and rights and responsibilities of the agencies as it relates to like the Americans with Disabilities Act and Section 504 of the Rehabilitation Act. It's a good idea for you to have some understanding as to what responsibilities you have versus what responsibilities the agency has. And a good place to look at that is the Office of Disability and Employment Policy, or ODEP, that's funded out of the Department of Labor, or the Job Accommodation Network, which is a wonderful tool that I use all the time to help with these things. So quickly, what is a reasonable accommodation? Under the Americans with Disabilities Act, a reasonable accommodation is a modification or an adjustment to a job, the work environment, or the way things are usually done during the hiring process. And these modifications enable an individual with a disability to have an equal opportunity, not only to get a job, but successfully perform the tasks of that job. The Americans with Disabilities Act looks at reasonable accommodations essentially within 3 areas, and that's ensuring equal opportunity for the application process, enabling a qualified individual with a disability to perform the essential functions of a job, and making it possible for an employee with a disability to enjoy the equal benefits and privileges of employment. And basically that just means that they can't discriminate against you. But these are good things for you to know if you are looking at trying to get a job. And the same thing goes for college as well. Reasonable accommodations are not the same as this definition, but they're very similar. Independent living options. This is, again, not a comprehensive list. This is just a list that I have that we commonly speak of these. But when you're thinking about living independently, you need to ask yourself the question, is living independently possible if self-management skills are learned? And what that means is, can you live independently if you know how to take transportation by yourself? If you know how to get out of bed, do living, do you know how to do those things? Can you do them by yourself? So you need to ask yourself that question. Accessible housing. This is a great way to become independent and to live independently if accessible housing is available. I understand that we have a nationwide shortage of accessible housing right now, but that doesn't mean it doesn't exist, and you want to check your local housing authorities for that. In-home caregivers, usually this is utilize coming out of some form of a home and community-based services waiver, that you have to qualify for services, but an in-home caregiver is exactly that, a person who comes into your home and can help you with your medications, can help you with whatever activities of daily living you might need. That person can come in and help you a certain number or certain number of hours a week. Supported living communities, these have different names, I think, from place to place, but like here in Florida, we have supported living communities that are not assisted livings per se, but they are just that. You have your own apartment and you live by yourself, but yet there's like the staff that can be there on hand if you need help, and they can take your trash out and, you know, take you places, things like that. Those, at least here, there are often wait lists for that, so just be mindful. Assisted livings, or what we call ALFs, that's usually what we think of, like, you know, if you need to live in a place where there is staff on site to help you with activities of daily living, med management, things like that. This is usually private pay. Someone can quote me, you know, to provide different information on that, but from my experience, it's been that assisted livings are usually private pay. Not to be confused with a skilled nursing facility or a SNF. Skilled nursing facilities are more from a medically based, or more medically based. You have to have what's considered a skillable need or a therapeutic need or a medical need. So meaning you need nursing or you need therapy. And this is, you know, you live in a facility and you get therapy and nursing so many hours a day. With skilled nursing facilities, that also can sometimes be covered under Medicaid. It depends, but again, that's a very state specific situation. So just make sure that you're mindful of how that works. And then you want to check your centers for independent living, because those are great resources. Most places have a center for independent living, if not multiple. I do want to touch on home and community-based services, because I had mentioned that earlier, because I think it's important that people know about it. If you don't know what a home and community-based services are, is it's types of person-centered care delivered in the home and community, what I just explained. And it's designed to enable people to stay in their homes rather than to be in a facility for care. So this is designed to help people not live in facilities if that is possible and safe. It usually falls into two categories: health services and human services. Each state can offer a combination of both types of these services, but they don't necessarily cover all services in each category. Navigating the healthcare system. This is primarily what we talk about here in this clinic. And I chose this infographic, this little graphic, because a lot of times people mention to me that after they age out of the pediatric world, it's like a jungle. It's like navigating a jungle. You don't know which way to go. You don't know what's lurking behind, you know, each tree, and you just don't necessarily know how to navigate things. And so I thought that that's a good analogy, because sometimes it can feel that way. So we try our best to provide skills and resources so that it doesn't seem so overwhelming. But to navigate the adult healthcare system, I'm by no means an expert. I don't have all of the answers, but some of the things that I could suggest would be understanding the differences between pediatric and adult care. As I had mentioned earlier, there's a lot more handholding and there's a lot more support in the pediatric world, and in the adult world, that's not so much the case. And as a result of that, the importance of having a primary care physician is so crucial. I cannot stress enough having a good primary care physician. Now, that does not mean having a quote unquote expert in spina bifida for a primary care physician. I'm sure that those exist, but I don't know a lot of primary care physicians who are quote unquote experts in spina bifida. But more so the question is does the provider listen to you? And are they willing to work with you and maybe talk to your specialists, because we have a lot of specialists that we have to see. And like for example, my PCP, she's wonderful. She's never worked with an adult with spina bifida up until me. She was honest about that, but she listens to me and she understands that my baseline is not going to be the same as her patients who don't have spina bifida. And she gets on the phone and she talks to my specialists, and I really appreciate that. So having a good PCP is key after you age out of the pediatric clinic. It's important for the person to understand your diagnosis. You have to understand what medications you take, your medical supplies. You are the expert in you. That's what I tell our patients is you are the expert in you. Yes, providers are experts in their field, but you are the expert in yourself. So, and because there is that lack of, care coordination on the adult side, it's even more so important that you understand that. And self-advocacy is key, as I have said throughout this entire thing. Tips for communicating with an adult provider. Not a comprehensive list, just my own from doing this myself and working with people. But first and foremost, make sure that they take your health insurance, because the last thing that you want to have is to see a doctor or to know of a physician and they are not on par with your health insurance. That's happened to me before. So check to make sure that they take your health insurance. Write a list of questions before each visit. I still do that. You could be out and about, and if you have a question, put it in your phone, or make a list of some kind so that when you meet with your doctor, you'll have questions to ask them. Utilizing online health portals if available. Example, MyChart. Here at Orlando Health, we use MyChart. I absolutely love MyChart. It's my favorite as both social worker and as a patient. Because it tells you your medications, it tells you your upcoming procedures, it tells you your after visit summaries. Those are my favorite because it'll give you an after visit summary of what you said with your provider. And those of us who have problems with retaining auditory information, it's great. So if you have something like that, utilize that. Developing a spina bifida elevator speech. And what this means is if you get into an elevator with somebody, you have all of 30 seconds to a minute with that, in that elevator. So if you had 30 seconds to a minute to tell somebody about your spina bifida, what would you say? What would you tell them? It could be different. It's different for every person, but think about what would you tell somebody if you had 30 seconds to a minute to tell somebody about yourself. Refer to the healthcare guidelines. These are so helpful. And a lot of, or I don't say a lot, but there are adult providers who don't even know about them. And if you're not familiar with them, it is a wonderful tool that helps educate providers and you about the best practices of care for people with spina bifida. It has everything from orthopedics to neurosurgery to transition. It's online. So I share this with all of my adult doctors as much as I can. It's so helpful. And then the last piece is just from personal experience. Asking a provider if they're comfortable managing spina bifida and avoid, have you ever had a patient with spina bifida before? You don't have to do this, but in my experience, if you say, have you ever had a patient with spina bifida before? Of course, more often than not, they will tell you yes. But that doesn't necessarily mean if they have experience or if they're comfortable. So maybe just keep questions more so about, do they have experience? Are they comfortable? That kind of opens up more of a dialogue. Insurance. This is, I know, a long, boring topic, but it is something that I feel is very important when we talk about adult healthcare. And in the United States, healthcare is most often tied to employment, meaning that you have to usually work 35 hours a week to become eligible for health insurance. And if you're unable to do that, then, you have to choose options through state-funded programs such as Medicaid and Medicare. You can go through the marketplace, but it's, again, been my experience that often this is not attainable or really useful for us because spina bifida there's just so much involved with spina bifida, and it can be quite costly for folks. So if you have to choose state-funded health insurance, meaning, you're not able to get it through an employer, it is often the only choice or one of the few choices for people with chronic medical conditions with disabilities, just due to high healthcare costs and things of that nature. And I shouldn't say that people have two options, but they essentially have two major options in this country that you can choose, either to obtain healthcare through your employer, if that's doable for you, or you choose Medicaid or Medicare if you're eligible, but you have to understand that these insurances, Medicaid and Medicare, are income capped and there are eligibility restrictions. And I'll get to that in a minute, but you need to understand that you have to meet eligibility requirements and that you're income capped. Which leads me to talking about understanding SSI and SSDI. And without getting into the weeds of it, SSI, SSDI, Medicare, Medicaid go together. And you have to understand income restrictions and the rules of Social Security to make sure that you don't exceed that incomes in order of losing your healthcare benefits. And understand how working impacts your disability benefits. You want to check local programs on benefits planning. Division of Vocational Rehabilitation is an amazing resource. Benefits planners, community work incentive coordinators, or CWICs. Not every place has a CWIC, but they're essentially benefits planners that they can talk to you about how working affects your disability or your benefits. Utilizing programs such as Ticket to Work or the Work Incentives and Planning Assistance, or WIPA. Again, those are state by state, but they all are available to you. And then you want to understand the term substantial gainful activity. And that essentially just means that how much money you can make up until your benefits are affected. And I won't get into the weeds of that, but you want to just understand what substantial gainful activity is. So what can you do? As I said, know your options, know what exists in your state after you age out of the pediatric system, whether that be Medicare, Medicaid. Are you gonna try and get a job and get health insurance through an employer? How expensive will that be? Things like that. Try volunteer work. Volunteer work is the best, as I said, and it's also not going to affect your benefits. So the more volunteer work you can get, the better. Take internships, but understand that paid internships will affect your benefits. Gain employment skills and obtain some type of post-secondary education. This is what I tell the youth I work with. I don't care what it is. You don't have to go to college, but you have to learn, you have to have something after high school, some skill, something that will make you employable, or, if it's volunteer work, but something after high school. I don't care what it is. I'm a huge supporter of college. I think college is great, but that's not for everybody. And this is just from me to parents and caregivers. So this is just me. But I think it's okay to set high expectations. I really do. I think that it's good. It's good to set higher expectations. That's not to take, you should take into account the disability, of course. But it's been my experience that if you set a bar high enough, they will do their best to match that. And if you have to adjust, then you can adjust accordingly. But high expectations is not a bad thing. People with spina bifida should be treated just like people without spina bifida in the context of having responsibility. And what I mean by that is like chores, for example. I'll give an example of my childhood. Like my sister and I both were required to do chores every single day, but my sister's job was that she had to clean the bathtub and the bathroom because she could get on her hands and knees, and it was my job to do the dishes and clean the table every single day, because so they weren't forcing me to do a job that I wasn't capable of doing, but I still had responsibility. So it's important. And then what's your backup plan when you're gone? And I know that this is a really touchy subject and it's a difficult subject, but it's something that needs to be talked about. How is your child gonna survive or thrive in a world where you might not be in it, or you might not be able to help them make decisions? You have to come up with a plan. Is there a family member? Is there a place? Is there a friend that can help them? And it has to be in writing. It's gotta be in writing. There's gotta be something in writing after the age of 18. I wish it wasn't that way, but you gotta have something on paper, and we'll get to that in a second. So this is talking about supported decision-making, that being on paper piece, the advanced directives. Everybody should have an advanced directive. I don't care if you have a disability or not. Everybody should have an advanced directive, whether that be a healthcare proxy or a will or a durable power of attorney, something. But this is, again, very, very, very state specific. But I just wanted to show you guys an example of here in Florida, what supported decision-making might look like if a person needs additional support after the age of 18, making important life decisions. Here in Florida, we have up at the top, you can see self-determination, supported decision-making, where you have more rights, which is like durable power of attorney, trusts, things like that, down to court-imposed guardianships, which we use guardian advocacy a lot here, which is essentially where you can cherry pick what supports a person can help make decisions versus being independent. So maybe a 19-year-old can open up their own bank account, but maybe they still need someone to help them make healthcare decisions, things like that. So again, I share this only because this is from Florida, but I'm sharing it to say that every state looks a little bit different on how this goes. But the whole gist of it is that after the legal age of 18, you have to designate somebody, you have to have some kind of plan. So just look in to see what resources are available. And if you need help, I'm happy to help you look. So this just goes to speaking of what if self-management's not working? You know, what if you're 19, 18 years old and you're still, you know, your child is still struggling to make decisions. That's okay. That's okay. Just make a plan. Designate a person to help make those decisions, make a plan B. If you're not able to help them, focus on skills. So this is just my experience, but I tend to believe that youth are much more capable than we sometimes give them credit for. I think that they are have a lot more capability than sometimes we give them credit for. So really test the waters, see what they're capable of doing. You might be surprised. I'm sure that you would be surprised. And then utilizing local disability support agencies such as Centers for Independent Living, vocational rehab, or local youth programs. They can help you with all of this. So just some key points. Independence is possible if you clearly define it and skills are developed. You need to have a clear understanding of who oversees, whoever makes, who is going to make those decisions. And transition is a process. It's not an event. It's not something that you start at 17 years old. I think the earlier the better, but it's a process. It's not an event. It takes time. It's important to clearly communicate your needs. It's important to be your own advocate and to learn to tell people what you need. And this is actually a quote from my mother. She said, she used to tell me, Shannon, you're going to have to learn how to navigate a world that wasn't made for you. And while I have the privilege of working with so many incredible people who are so invested in making this world more accessible, you still are going to have to navigate the world, and it might not meet your needs specifically. So that's the best piece of advice I could give. And with that, I do have some resources here. This is not a comprehensive list at all. And I believe that there are some SBA resources that I did not include here. But if you have questions, please reach out to me, and hopefully this was helpful. Thank you.
Thank you, Shannon. While we see if there are other questions from the participants, what would you say is the very first step to take? You're over 18, you're out of pediatrics. I may have heard you say, make sure you get a primary care provider, but what would you say is
Yes.
the absolute minimum to go?
Yes. Get a primary care physician and understand whether or not you're going to work on supported decision-making or if you're going to do that yourself. And it actually to start working on that. If you do need someone to help you make that decision, you start that before 18.
And you suggested you go there and make the appointment, make sure your insurance coverage works, and ask if, what's the question? Not have you seen other people with spina bifida? What would you say? If they're willing to see someone with spina bifida or with a disability?
Yeah, just to say, have they had experience working with someone with spina bifida, or if they're comfortable? You don't want to just right out ask, hey, have you ever had a patient with spina bifida before? That's kind of abrupt, and they'll probably tell you yes. That doesn't mean that they're comfortable with it. So.
And you have to, I would think, like the person needs to work for each person, right?
Yeah. Yeah. And providers, I mean, they're people too. They want to do the best for you. And sometimes you just have to ask what their level of comfort is.
Right. And I just want to say that the National Resource Center at the Spina Bifida Association is working to compile a list of adult providers who are interested in seeing people with spina bifida, and we can assist to the extent we have information in people's areas. So reach out to us. We have a question. Are you aware of coaching resources to help navigate self-management? This is a parent asking for their adult.
Yes. So again, this is state specific, but I should include this. The National Collaborative on Workforce and Disability. That is a really good place that you could try. They have like a hub for, I guess, I don't know if you want to call it coaching or mentoring, but there's like a list of places that you can go to pay, depending on your state. But a good way to look at it is if you're wherever your local disability support centers are, they should have like, you look for words like youth programs or life skill programs, things like that. I don't know if that helps.
And we could add that resource to this list to come with the recording, couldn't we? Oh, there
And
it is.
Centers for Independent Living. I know I've said that like 5 times, but Centers for Independent Living can be so, so helpful. They have youth programs. I mean, I don't know if they do other places, but here there, I think, are like 4 or 5 centers for independent living that they have specific youth programs that do self-management. So
what if a parent is working with I'm gonna pick an age, 22-year-old, and is trying to encourage self-management, and the youth is not interested? What is the parent to do?
well, I would say utilize transition readiness assessments if that's possible. And I think there's something to be said about getting connected with other youth who have spina bifida. Sometimes it works. A better approach is if if it's not a parent approach, but if it comes from another peer, so like peer mentoring. So I would say try to focus on the skills. If you can utilize like an assessment of some kind, and set, try to work on those goals. But try to encourage youth support, or if there's a coach, or if they're anything that they're interested in, like if they're interested in, I don't know, volunteering somewhere, you would be surprised being a part of like a volunteer group or being on an adaptive sports team or something like that can really, really help self-management. Actually, a lot of times what I'll encourage is if a child or if a youth is not really wanting to partake in self-management, I'll say, well, see if they want to join adaptive sports, because if they join adaptive sports, think about it, you have to be on a team, and part of being on a team means that you have a certain level of responsibility. Sometimes more often than not, there's a coach and you have a certain level of expectations there. So I've seen a lot of teenagers learn to take personal responsibility once they like get onto a sled hockey team or something like that.
Is there a place for tough love?
I think so. Not too tough, but I think that, yeah. But again, I speak from a personal standpoint on that. I had very loving parents, but they were very strict. But I, live on my own, and I was able to learn how to take care of myself. So, but I think that there is a place for that.
Okay, here's a question. Do you have any tips for someone who struggles with urinary issues to help minimize these issues? A person struggling, waking up wet in the morning and leak throughout the day.
As it relates to just self-management, yeah, so if you're struggling with that, first of all, you want to get on a cathing schedule. Like you'd want to work with your urologist and see if there is a cathing schedule. But there are some apps. I don't know if I know the apps right off the top of my head, but there are apps that can like remind you of when to cath. Sometimes going back to that self-management piece of having a lot to remember, sometimes putting reminders in your phone, or having apps that will kind of help you remember to do those things. Sometimes that helps. Sometimes, if you're cathing, for example, I tell people, well, is it the right catheter? Do you like the catheter? Does it fit well in your hand? Can you use it well? Can you manage it well? Like, I mean, do you like to use it? A lot of times what we see, or I see, is if they're not taking a part of, if they're having problems with continence, sometimes it's the fact that, they just don't have the right catheter that they like. So, but I would also make sure that you work with your urologist.
Any last questions from any of the participants? Remember, you will receive a recording, you'll receive a list of the resources and an evaluation, and please complete the evaluation so that we can learn what topics may be important to you for future sessions like this. And Shannon, thank you. Thank you so much for sharing your experience and expertise and always being there for us. So thanks, everybody, and have a great evening.
Thank you.
Night.